Today, some members of Domestic Violence Act Coalition met in Kampala to express what they see as pressing issues for women that should urgently be addressed during the ongoing lockdown. This follows reports that some women have been sleeping in the markets to avoid contact with their family members, a great personal cost. However, the health ministry gave out mosquito nets to these women to prevent malaria infection.
They also need safety and protection from possible sexual abuse that sleeping in the environment exposes them to. They require adequate lighting and safe water, sanitation and hygiene facilities as well. Furthermore, the needs of women with infants, pregnant and lactating mothers remain unmet.
As many women continue to serve as frontliners during the pandemic, with many working in healthcare system, law enforcement and others serving on various COVID task forces, they are exposed to high risk of contracting COVID-19, abuse, sexual harassment, and violation of their sexual and reproductive health rights.
The coalition of these NGOs highlighted the fact that some of the women who are sleeping in the markets as a way of curbing the spread of COVID-19 have been assaulted by men, especially at night. I therefore asked them whether they have any evidence to prove that, and if also they have conveyed their demands and recommendations to the relevant authorities like police, Ministry of Health, and the Office of the Prime Minister.
Let me call it a survey of sorts, concentrated in 3 markets, in Nakawa, Kawempe, and Kaleri. And it was speaking about generally what issues that women were facing in the markets during the lockdown. And one of the issues that came out very strongly, at least in all those 3 markets, was the issue of violence from the men that share markets with them at night. That when you are unable to pay that fee that you pay for each vendor that sleeps in the market, that some of the men do continue to ask that you have sex with them.
You know, there are girls and boys in the home, thousands and thousands. But because of the physiological nature of the girl, which makes them vulnerable, their sexuality makes them vulnerable. Have you had a boy who has been pregnant during COVID?
During the second wave that has seen a rise in COVID-19 infections, they are calling for increased awareness of benefits of vaccination against the pandemic.
A market where you're asking the heroes of this country, the women who sleep in the markets, that should have been the first area. I do not see how a woman should move from the market to now walk to a health center. You've convened them there already. Let a vaccination point be put there, if indeed you're putting their issues into consideration.
Lack of accurate information has led to rejection of useful information from credible sources such as Ministry of Health and World Health Organization, and resulting to self-medication and mistrust of the healthcare services.
The women activists have asked the Office of the Prime Minister to increase the relief money from 100,000 to 300,000 shillings and to add women doing small businesses to the category of the vulnerable. Sudil Biarhanga, NTV.